The Cancer Imaging Program of the National Cancer Institute has a mission to promote basic translational and clinical research in cancer-related imaging sciences. The program has a wide-reaching portfolio of resources and initiatives to foster cancer imaging and is among the most influential federal programs in radiology research. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and in this video article, I have the distinct pleasure of being joined today by Dr. Janet Eary, who has been director of the program since 2016. During this time, she's pursued an ambitious agenda that has heavily grown the program's influence and reach. Dr. Eary, thanks for joining us.
Thank you so much for this opportunity to speak with you today.
So to start us off, can you tell us about yourself, including your background in radiology and cancer imaging?
Well, I'm trained as a nuclear medicine physician, but also in anatomic pathology and laboratory medicine. And I had an academic career at the University of Washington in imaging and imaging research and clinic and the training program there.
And then what made you decide to join the NCI Cancer Imaging Program?
I responded to an invitation to apply to the program, and I thought it would be a great opportunity to increase the contribution that I could make to the imaging community and to patients with cancer research.
For our listeners, can you tell us in a nutshell the program's mission?
Our mission is to facilitate the use of imaging in cancer to improve patient outcome.
That is a very clear and important mission. Have you seen any changes at the program during your time at the helm?
Yes, we've made a lot of effort and been very successful in expanding our collaborations and outreach to different divisions across the National Cancer Institute and the NIH, as well as other government agencies, to expand the conversation of the imaging community with all these different areas. It's been very exciting to see.
What new innovations do you see on the horizon that radiologists should know about?
I think we can look forward, of course, to what everybody's talking about these days, and that is new applications in machine learning and artificial intelligence that help the radiologist and our referring physicians understand the imaging information, as starting from scheduling a patient and appropriateness criteria, image quality, and of course, interpretation. And then not to mention incorporation of important imaging data into the report, which goes eventually, I think, probably into a combined diagnostic report. I've seen great progress in all these areas.
Any specific new programs that you'd like to highlight?
At the cancer imaging program, sure. There are quite a number of them. Recently, we've engaged in the molecular imaging community in introducing the use of synthetic biology and interacting with the synthetic biology community in discovery of new imaging agents. We have been engaged in a number of very innovative clinical trials, and a number of investigators have done the same, not to mention image analysis, the quantitative imaging program. We could go on and on. The clinical trials research initiative, I could go on and on. There are just lots of really great new initiatives, including several in cancer biology. One that involves combination of imaging data and liquid biopsy, as well as another one where we are specifically interested in investigators with applications and understanding the role of inflammation in cancer. There's a lot of great and new exciting areas that people are pursuing that in programs that we've initiated.
Any exciting clinical trials underway for particular cancers that you'd like to comment on?
Sure. I'm most familiar with the work of Alfred ECOG, and in that group, there are a number of trials that are very exciting that are well underway in breast cancer imaging using FDG and fluorine-18. And in prostate cancer and radiation oncology in treatment modification based on the results of the PSMA PET scan, PSMA type-based PET scan, not to mention image analytics in glioblastoma and integration with other clinical data. There are a number of very exciting, very forward-thinking trials that are underway.
How do you personally decide where to focus and what to prioritize?
Well, I don't personally decide where to focus and what to prioritize. I mean, I do have my own ideas and items for agendas, but it's a collaborative effort from members of our program, our collaborators at the NCI, and of course, what the NCI leadership has designated as focus areas, such as the National Cancer Plan that has recently been submitted and reviewed. So that our agendas for areas that we'd like to pursue and focus on come from a variety of sources.
One of the program's more well-known initiatives is the Cancer Imaging Archive. At AJR, we received numerous submissions from research teams using that data set. Can you tell us about the archive and where you see it headed?
The archive is about 12 years old now, and initially began with collections of DICOM data, primarily from body imaging, CT, MR, and later on PET imaging. And now it's very well known worldwide because of its high level of curation and state-of-the-art de-identification of data. It's also completely open access to the public. And so it has a great reputation there, and it's been very groundbreaking in techniques and approaches to providing open access de-identified data. It's very exciting to see how much use the archive gets every month. I think about 4 terabytes of data are downloaded with more than 20,000 users at each month, and we do keep track of that. Its data has been used to generate any number of patents, and as you mentioned, research papers, grant applications. And more recently, we have expanded beyond being interested in only DICOM data sets to other types of data types that are other types of data that are generated from other imaging modalities, such as optical imaging and ultrasound. And we've been encouraging investigators to be more thorough in submitting metadata so that there's plenty of clinical data and other diagnostic data and other scientific data associated with the imaging data sets to enrich them for research.
Related to the archive, you've talked in the past about your program maintaining a culture of data sharing and collaboration with publicly available data sets from diverse populations worldwide. What challenges have you faced in implementing open science, and how have you addressed those challenges to be successful in this regard?
Well, we receive the data as the investigators submit it to us, right? So it reflects the data that they have. And what we are doing at present is encouraging investigators to take a look at that data and try to understand the demographics and diversity of that data to see if they can make sure that the data that they're acquiring does represent a more diverse population. So part of it's a lot of conversation and dialogue. And that's also being addressed by the encouragement of submission of metadata associated with the imaging data sets. So that's also available for open access to see what types of populations the data represents. So there's a number of activities that we can undertake to encourage people to be aware of the need for diversity and for the robustness of the data for whatever research application that the data in the archive might be used.
Well, your agency has certainly accomplished a lot in the name of open science. In your talks, you've also discussed the Great Divide Challenge, which, as I understand it, relates to strategies for closing gaps between imaging and clinical communities in applying imaging innovations. Can you describe this more to us and describe the agency's current efforts to link researchers and practicing radiologists?
Well, part of it is identifying what those challenges actually are. And sometimes the more questions you ask, the more answers you get, of course. And for each specific situation, the challenges might be a little bit different. In the program, we've tried to provide a number of pathways for development and translation of new imaging methods and approaches through funding and through different types of research collaborations. So we're very, very well aware of those. The other thing we try to do is help folks, investigators, be aware of resources that are available to them to help navigate through those challenges.
You also emphasize diversity, equity, and access with respect to cancer imaging. How do these areas fit the program's current activities?
Well, there are some very specific things that we do in program, besides encouraging the imaging community to be aware of these issues in collecting data and making it uniquely universally applicable to different populations. But there are a number of opportunities in special supplements and different types of grant awards that are specifically designed to help examine diverse populations. And we spend considerable energy helping demonstrate and have conversations with investigators on where those might be and how that might fit with their research.
What measures is the agency taking to address bias and fairness in cancer imaging research?
The same sort of thing. We work certainly in the archive and with the investigators and our various program announcements to emphasize these areas that may or may not be problems with the data. But I think the most important thing that we can do as communicators and facilitators of conversations throughout the imaging community is to help make folks aware of these potential problems and ways of addressing them. And those have been very productive conversations.
And as we get to our final questions, what changes do you see in the cancer imaging program in the coming year?
We can look forward to potentially more opportunities for imaging research as we continue to see the emphasis coming from the U.S. government administration on cancer. And the cancer imaging program and people in the NCI are very engaged in these conversations and opportunities to see what we can do to help contribute to improve the outcomes of patients with cancer. So those will be some changes that we may be seeing as the year comes through, and we're hoping to see changes that improve funding levels with budgets.
Any tips that you have for radiologists who want to get involved in cancer imaging research?
Sure, and that is to talk to folks in their departments and their divisions. You know, peer chat, peer counseling is a great thing. Look at the resources that the major imaging organizations and biology organizations have on resources for applying for grant activities. Have a look at our website, and that's cancerimaging.gov, or give us a call. All of our contact information is there. We'd be happy to help you get started, or at least point you in the right direction towards some other resources. It would be our pleasure to do that, and we'd love to hear from you.
I'm sure your collaborators really appreciate that level of engagement and support.
Sure.
So last question, if you had to pick one thing that you'd most like for your program to accomplish in the next year, what would that be?
That would be to increase the funding of the applications that have been submitted and that are very meritorious, but are sitting in a state of not being funded at this moment because of budget limitations. So one of the things that we'd like very much to see is funding of these applications, which really have great science in them, and see if we can help find a way to have those transit the system and be funded. That's what's on our minds right now.
Well, let's all hope you succeed with that goal.
You're right.
Dr. Eary, thanks so much again for being here.
It's my pleasure. It's such a wonderful opportunity and invitation to talk about these areas which are really important to all of us in the cancer imaging program, and I hope within the imaging community. We love to take any opportunity that we can to communicate with the imaging community and share our information and establish the conversation. So thank you so much.